COVID deaths, hospitalizations, and new infections are surging across the United States, while Trump is holed up in the White House nursing his wounds. The Associated Press is reporting that aides say the president has shown little interest in the surge. Meanwhile, yesterday, the country recorded a staggering 148,000 new cases and 1,500 new deaths in a single day. That is a 36% increase in deaths over a 2-week period. According to the Washington Post, at least 65,000 Americans are currently hospitalized with the virus, which is pushing healthcare systems to the brink. In Michigan, the CEO of Spectrum Health, which operates 14 hospitals in the Southwest and Western Michigan, announced that their hospitals are nearing capacity. South Dakota set yet another record today for the number of new coronavirus cases, and in Wisconsin, hospitals might no longer be able to save those who need saving because the surge is overwhelming the health system there. Infectious disease experts have warned that the surge is likely to get much worse over the next few weeks.
This pandemic has affected more people and the hospital capacity and hospital issues in a much broader fashion than anything I've ever seen before.
I think it's only going to get worse because the higher the community spread, the more and more everybody's affected from all sides.
I'd say wear your mask because I almost died from it. It's more serious than people think. I just think people aren't taking it serious enough.
Joining me now is Dr. Lipi Roy, internal medicine physician, and Lois Pace, president of the Global Health Council and member of President-elect Joe Biden's COVID-19 Advisory Board. Trying to speak properly here tonight. Dr. Lipi Roy, my friend, we heard Dr. Baker I don't know if you were able to hear the tease before we went to break, and he made a point that I think a lot of people had sort of put to the back of mind that, you know, hospitals do more than treat COVID. And he was saying that here's the challenge. They've got other patients that they are not able to get to, that they're not able to give proper time to, and maybe even have to turn away because COVID is surging all of their capacity, taking up all the beds. So are we now looking at a multiple health crisis that we're going to be looking at in this fall and winter season?
Yeah, Joy, it's really good to see you. You know, as hospitals across the nation are being crushed by the massive surge of COVID-19 infected patients, this is obviously, as a physician, not only affecting me professionally as the medical director of COVID isolation and quarantine sites here in New York for Housing Works, but it's also impacting me personally. 2 days ago, my own father was hospitalized for shortness of breath and wheezing. Turns out we found out it wasn't for COVID-19, but he was waiting in the emergency department for a long time, waiting for a bed up in one of the floors because the hospital was just full of people infected with COVID-19. My father's story is not unique, Joy, as you just pointed out in that excellent footage. As we head into what modelers and experts are predicting to be a dire winter season, millions of people with all types of medical conditions, from liver disease, heart disease, hepatitis, cancer, who need hospital-level care may just get turned away. And remember, the limitation isn't just space, Joy. It's not just hospital beds. It's equipment and ventilators and medications, but our most precious commodity, the rate-limiting step, is going to be healthcare workers, those frontline nurses and respiratory therapists and doctors, physical therapists, OT, occupational therapists. Remember, it takes years to train these really brave, hardworking men and women, and right now they're really getting burned out and they're getting sick. So this is what needs to be addressed. Since our federal leaders aren't really, they've surrendered on this, we need to depend on our governors, state governors, and local leaders to step up, Joy.
And we certainly wish your dad well, and thank you for sharing that with us. And, you know, Ms. Pace, thank you for welcome to the show. I want to let you listen.
You.
Sure, of course. There is sort of a debate that's happening right now. We see it in New York City, where there's a whole debate over lockdowns, and there are a lot of small businesses that are really struggling. And as you get to winter, you can't see people outside. And so the idea that we would go back into serious lockdowns and having to close restaurants early, it's really traumatizing a lot of small business owners and people who own gyms and other things. But I want to let you listen just to what the debate has been. So the first person you're going to hear is Michael Osterholm, who's also on the advisory board for incoming President Joe Biden, as well as Dr. Anthony Fauci, who are kind of giving you the two sides of the question on lockdowns. Take a listen.
We could pay for a package right now to cover all of the wages, lost wages for individual workers, for losses to small companies, to medium-sized companies, for cities, states, county governments. We could do all of that. If we did that, then we could lock down for 4 to 6 weeks. And if we did that, we could drive the numbers down.
Dr. Fauci, do you believe that we're headed for a national lockdown?
You know, I don't know. We would like to stay away from that, Robin, because there is no appetite for locking down.
And I want to just point out that Michael Osterholm, who's an epidemiologist and a Regents professor at the Centers for Infectious Disease Research and Policy at the University of Minnesota, he actually has backed down from the lockdown position since then. And incoming President Joe Biden said that's not what he's for. But where do you come down on the idea? Should we be thinking about a 4 or 6 week lockdown to try to get a hold of this virus?
You know, I think that those two interviews really reflects the spectrum of opinion that you will find among some in the scientific community. And rest assured, we are all very clear on the core public health principles and practices that we really need to have and keep in place. Of course, everyone as individuals has a role to play. As the president-elect himself has said, we should all be wearing masks. We should all be limiting our social interactions and gatherings, however painful that might be for us to continue. These steps that we can each take are critically important. And of course, we need to also still have these very real systemic measures that we need to have in place. And these are the kinds of things that I know the advisory board will be consulting on, right? And will be sort of recommending for the incoming administration, ensuring that there is clearly a ramp up of testing, ensuring that we have a strong supply chain so that we're not running out in terms of PPE and other preventive measures. And then, of course, as Dr. Roy was saying, supporting the public health and healthcare infrastructure, which is under strain now, even before we see sort of this wave that we're all fearing. It's really a nightmare scenario. And so, of course, we're going to also have perhaps some debates as part of the advisory board. That's why they selected us, I believe. They wanted a diversity of thought and perspectives, not just around some of the approaches and solutions, but also just given our various backgrounds, you know, recognizing that some of us are really going to be focused on health equity and disparities, for example. So I'm looking forward to that. I'm really grateful that the president-elect and vice president-elect brought us together. And I'm confident, especially given the plans that they had in place until now, you know, I'm confident that we can really find a solution for the American people. But it's really going to take all of us, and it's really going to require a whole of society approach.
Yeah, and I think for a lot of people, it's a relief to see the diversity on that council, and that disparities are one of the things that are going to be talked about. Very quickly, Dr. Roy, you know, Dr. Vin Gupta was on with me the other day on another show, and he was saying if he could pick one thing to do, it would be send everybody an N95 mask. Is that something that you would recommend as well?
Well, I'm so glad you brought up the idea of masks. N95s are obviously critical for frontline healthcare workers. But right now, Joy, we have enough data just to show that masks themselves can really reduce transmission. It's just not happening. It needs to be mandated. If seatbelts are mandated and about 100 people die per day from motor vehicle casualties, we have 10 to 15 times that casualty from COVID-19. We know how to prevent it. I don't care if it's an N95 or this, just wear a mask.
Very quickly, I think we're out of time, but Ms. Pace, do you agree with that very quickly?
I certainly am fully on board with the idea of masks, and I know that not just the idea of it, but the recommendation of masks. And we know that the president-elect has also spoken about the importance of working with state and local leaders to ensure that we are really practicing that consistently on a national level.
Mask and distancing too.
Yes, indeed. Dr. Lipi Roy and Lois Pace, our own little in-house advisory board on COVID. Thank you both for being here.